I work with the North Dakota Department of Human Services Behavioral Health Division. The Behavioral Health Division manages the federal funding for the PATH program in North Dakota. This is the first in a three-part webinar series to provide information and education for the North Dakota PATH program. PATH stands for Projects for the Assistance in Transition from Homelessness. PATH assists adults who are homeless and identifies having a serious mental illness. In North Dakota, the PATH program is implemented through PATH coordinators who are located at each of the 8 regional human service centers. The training is being conducted by C4 Innovations. C4 Innovations partners with service organizations, communities, and systems to implement research-based solutions that are person-centered, recovery-oriented, and trauma-informed. Our trainers today are Jonathan Cox and Amy Suhu White. Jonathan Cox is the Director of Housing at C4 Innovations with 30 years of experience working in the areas of homelessness, substance use, and supportive housing in both the United States and the United Kingdom. John provides technical assistance to HUD Continuums of Care with an emphasis on housing first and rural communities. He also works with recovery housing projects on policy, best practices, and capacity building. Prior to joining C4, John was a planning manager for Georgia's Balance of State Continuum of Care and Entitlement. Amy is a training and technical assistance provider at C4 Innovations with over 10 years of experience in the homeless services and behavioral health fields. She previously served as the PATH Technical Assistance Lead for SAMHSA's Homeless and Housing Resource Network, where she supported the PATH program's transition to using HMIS for data collection and led the rollout of trainings for the PATH data exchange. Prior to joining C4, Amy worked as a PATH outreach worker in Boston, Massachusetts. Thank you and enjoy the webinar. All 3 webinars will be recorded and available for viewing on the Behavioral Health Division website in the future. Thank you for joining us, Amy and Jonathan.
Great, thank you so much, Tammy, and welcome everyone. Thank you for joining us today for our PATH 101. Here we just have a quick orientation to our Zoom room. Everyone is muted as they come in. You do have the ability to unmute yourselves. We'll have a Q&A session at the end, and so you can feel free to unmute yourselves and speak up to ask questions. Please also use the chat box throughout for any assistance that you may need or any questions that you have. And also just to get started with kind of warming up our chat box, if you don't mind introducing yourself, sharing your name, your role, and the number of years that you've been with the PATH program. We'd love just to get to know everyone a little bit. So you'll see here just an orientation to the Zoom room. One thing to point out is there is the ability to generate a live transcript, closed captioning, if that's something that would be helpful to you. You'll see that highlighted on the screen in yellow, how to access that. Otherwise, if there's any other technical issues that you have throughout the presentation, please reach out to our technical support staff, Marcia, in the chat box, and she'll be happy to help you. If you're having any trouble with audio, you can also call in by phone, and Marcia can help you with that if needed. So welcome, please go ahead and introduce yourselves in the chat box, and if you're interested and able, please join us on video as well. We love seeing everyone's happy faces. All right. So we'll go through our learning objectives for today. Our goal with this presentation is that by the end, you'll be able to identify PATH eligibility and enrollment requirements, describe the services that can be provided using PATH funds, name strategies for making successful referrals, describe ways that you can be involved with your continuum of care, describe the PATH data collection workflow, and identify best practices that lead to effective PATH programs. And as Tammy mentioned, this is the first in a series of webinars coming up. On Wednesday, we have an effective outreach webinar that our colleagues Ken Crable and Stephen Samra will be leading. And then next week, we have a training related to PATH, specifically to PATH data collection. So our goal here today is to provide a broad overview of really the basics of what builds a successful PATH program. Some of this you might know already. We just want everyone on the same page, and then also the ability to just engage and ask questions. So that's really what we're looking at for today. And so to achieve those learning objectives, this is where we're going on our path today. We're going to start with a racial equity framework, a very important foundation for all of the work that we do. Then we'll go through some PATH background and talk about the eligibility requirements. We'll go through path services and referrals, what those look like, an introduction to data collection. Again, we're going to dive more deeply into that in our webinar next week, but just to provide an introduction to that, and then talk about best practices and building effective path programs. So I'm going to turn it over to John now to help us frame our conversation in terms of racial equity. John?
Thank you, Amy. First of all, welcome, good afternoon. It's a pleasure to be spending some time with you over the next hour or so and to discuss PATH and all things street outreach and all that good stuff. So I've noticed that a few of you have put your name, your title and how long you've been doing PATH into the chat box. We'd love to see a few more. I can see that some of you are real old hands, lots of experience. Others of you are bringing the new enthusiasm to PATH, and both are great to see. Things change, things evolve constantly, and that's just the nature of the work we do. And over the last few years, one of the things that has rightly risen to the fore is our looking at our homeless service systems and are looking at street homelessness through a race equity lens. And race equity means different things to different people according to which part of the nation you're in. If you are in urban, eastern or west coast city, that will almost certainly mean that you're looking at that racial equity through an primarily African American, but also through a Latinx perspective, and looking at issues related to race equity there. Other areas, and often more rural, but also spread across the country, are looking at a tribal lens. We're not going to have a deep dive into race equity today, but we are going to spend a few slides thinking about race equity and looking at some practical things to think about. If this is something that you finish this webinar and sigh and say he barely scratched the surface, well, I meant to barely scratch the surface. If you want to have more discussion around race equity, we can spend plenty of time, in future events or outside of this whole process talking about race equity. But I think it's important to frame race equity within all of the work we do within the homeless service system. So these are just a few considerations, and we start with some ideas and thoughts, and then we move to some practical things that you can do in a nutshell. We know, we've seen evidence and research. Some of that research has been done by C4, but there is plenty of other evidence. HUD is currently doing, some research around, some pilots around homelessness and outreach and housing for Black and Indigenous people of color. And, one of the things that is shining through is that people of color are experiencing homelessness at disproportionately high rates. And that was true 2, 3, 4, many years ago. But over the last year and a half, there's been a double whammy. There are, the pandemic has meant that many people of color are, disadvantaged multiple ways. They're often experiencing much higher rates of infection and death related to the pandemic. And then that whole structural, institutional, interpersonal racism that impacts our safety, economic mobility, and our housing stability within, within BIPOC communities, is really being stretched as we go through, pandemic and recession. Can we take the next slide, please? So I think it's important to acknowledge that, you know, that this pandemic has hurt all of us, but it hasn't necessarily hurt all of us in equal ways. And, you know, this is, you know, one of the things that we know is that our communities of color have been, you know, negatively impacted in a disproportionate way. So some of the things that we've seen are that, you know, high rates of job loss due to the pandemic, and that's often in service industries. And often when we think about, you know, our folks who are experiencing homelessness, many of them fall into that service industry category. Eviction hearings, you know, we have been lucky enough that the CDC has, you know, kept the eviction moratorium through the end of July, but we're, you know, we all have concerns that as, you know, eviction hearings will start to increase as protections are lifted. And, you know, just communities of color are often disproportionately affected by those evictions. Can we go to the next slide? So we know that they're disproportionately impacted by those evictions. And then with the pandemic, what the pandemic has done and the recession has done is it's impacted our ability to rely on natural support. So, you know, many communities of color often use couch surfing. They use local communities, you know, they're often strike deals to have nighttime access just for sleeping or finding places to shower. That's been impacted by, you know, that maintenance of 6 feet of physical distance. It's been impacted by people, you know, limiting exposure outside people's bubbles or, you know, small communities. Many people have spent the last year sheltering in place. And so there's been less community contact. And that has had an impact on many communities to, you know, to reach out and find those natural supports. And then we know, you know, that racism perpetuates the denial of economic mobility among marginalized communities, which is why when we go through these periods of recession, it has that you know, much larger impact on people of color than it does on the communities as a whole. I'm not saying that other folks aren't impacted and impacted in major ways. This is not a, you know, people of color are impacted more than, you know, and no one else is impacted. But what it does show is that communities of color, people of color are often, you know, amongst the most impacted within that. Okay, can we move along? So, what does this mean for us? I mean, that's a great, what I call admiring the problem. You know, we've laid out the issues, but what are some of the practical things that we can do to resolve this? And this again is just some quick and dirty ideas. We'd be happy to discuss it more as people want. Implicit bias training for frontline staff. We're all biased. We all contain and hold biases, and regular training around the biases that we hold and how to examine, how to contemplate, how to move past those is extremely valuable. It's doubly valuable if you're a path worker, if you're doing street outreach. You know, street outreach and other outreach services for path are often very sharp, they're very quick, they're very determined. You know, you don't have the luxury of spending, oh, well, you know, we'll spend 6 months getting to know one another. You may choose to do that as an intervention to break down trust, but you know, the norm for path workers is that you're moving quite quickly, and having that implicit bias training can be critical to folks as they, you know, as they may need to think through things. Develop community-driven solutions by including people with lived experience. Can't stress this enough. And that's a concept that really has grown a lot from the recovery world, and is really the homelessness and housing world is starting to catch up with those ideas. So people who you know, with lived experience have expertise in understanding those, you know, how you know, how folks of color and communities of color have been, you know, have not necessarily had the same level of service and access that other folks have. Understanding their perspectives by including people with lived experience is critical as you look at a race equity you know, lens or focus within your work. Strengthening and enhancing partnerships outside of the service system. Places of worship, landlord networks, workforce development. This was brought home to me 2 weeks ago when I was interviewing a PATH outreach worker in Georgia. And he lived in a small city, and he had noticed that the data that he had was, you know, predominantly white people. And he very much, you know, said, well, we're not all, you know, we are, well, there are a lot of white people in the city, but then it's not an exclusively white city. Why am I only working with and serving people, you know, who are Caucasian? And so he sat down and he started to make a list of, you know, other potential providers that he wasn't working with. So, you know, these included things like ministers from local churches. These included things like community centers. And what he found was that he was missing people. He, you know, he sat down with a group of African-American ministers and discovered that, you know, they were still serving communities of color who had people who were experiencing homelessness. They just weren't necessarily connecting them to the whole outreach and housing service system. So just by looking at his data and thinking through, what am I missing here? He was discovering that he needed to rethink the way that he did outreach. And so just started doing that by word of mouth, started making, you know, cold calling connections and started rethinking it. And it's early days, but he's starting to see his data change and reflect that. Can we go to the next slide, please? So, practical things. We all collect data. Everyone needs to collect data. You know, we all love to be paid with our grants, and that usually means some level of data. So as we start to track and analyze disaggregated data, and that's, you know, that is usually through the HMIS system, you know, start to look at who is getting referrals. Who am I seeing on a day-to-day basis? Who is getting housed? Does this match, you know, the poverty levels in my community? Does this match the census levels in my community? Does this match the breakdown of folks who are accessing emergency shelters? And start to look for patterns and discrepancies. So who's getting housed? Who is getting those services? What type of services and resources are being provided, and to whom? Just breaking out that data by racial and ethnic lines will start to help you build out, you know, what you're doing well and what may need to be looking at. Is it working for everyone? You know, is it working for youth? Is it working for our senior folks? Is it working across racial and ethnic lines? And then when you've got that data is great. Stats can tell you a lot, but they can't tell you everything. And, you know, it's worth taking those statistics and going and sitting and talking to people. And in some communities, we do that across the world, across the board. Others, we look at, we might do it with some tribes and start talking to representatives of tribes. Others, it may be in the Latinx community, but we start thinking about that and saying, this is the data we've shown. Does this match your experience? And if not, why doesn't it match your experience? And then we start to work upstream to start thinking about the underlying and root issues, and then we start building out our strategy. So as we go through all of that, I want to encourage you to think about doing that with a racial and an equity lens and focus. Doesn't mean that it will particularly change the way that you work, but I do want you to think about how that impacts any particular communities that may be underrepresented in your work within the state. Okay, hopefully that makes sense. I'm not seeing a huge amount of questions in the chat box, which is usually a good sign. So I'm going to hand it back to you, Amy.
Great. Thanks, John, for providing that framework for our discussion today. So now we're going to shift gears a bit and jump into some background about the PATH program and just provide a really broad orientation to it. And again, we're all just going to make sure we're jumping off on the same foot with this program. So PATH, as Tammy noted in her introduction, PATH stands for Projects for Assistance in Transition from Homelessness. A little bit of a tongue twister there, but a good trivia fact if you ever need it. It began in 1990, authorized under the Stuart B. McKinney Homeless Assistance Amendments Act. This was really the first major federal legislative response to homelessness, and PATH was included in that package. It's a federal formula grant. It's administered by the Substance Abuse and Mental Health Services Administration, or SAMHSA, and it gets distributed annually to each state, the District of Columbia, and 5 U.S. territories. And so by formula grant, it means that it's administered based on a formula according to the state's population. And the states and territories then determine how to use their PATH funds based on their state's needs, their community's needs, within the parameters of what's allowable with the PATH menu of services. In fiscal year 2019, which is the most recent federal data available, there were over 66,000 individuals who were served by the PATH program, enrolled in the PATH program. So that gives you a little bit of a sense of the scope of the PATH program nationwide. So the PATH program is dedicated to a particular subset of individuals in the population of people experiencing homelessness. So there's other federal funding streams that are dedicated to serving anyone who's experiencing homelessness. But PATH is focused on a very particular population of those who are experiencing both homelessness or at risk of homelessness, and also have a serious mental illness. And this is really part of the recognition that this particular subpopulation could benefit from some targeted services, and that these are often people who will not seek out services independently and need that outreach, engagement, that specific time that can be spent to support them in getting any services that they want and need. So we'll go through just so we're clear about what the definitions mean in terms when we're thinking about PATH eligibility. And these are some SAMHSA definitions: so serious mental illness, a diagnosable mental disorder, such severity and duration that it hinders it has functional impairment and it interferes with major life activities. So when you think about some of the individuals that you're working with the PATH program, hopefully you can see ways in which this definition applies to them in terms of having a serious mental illness. And then in terms of experiencing or being at risk of homelessness. So experiencing homelessness, it's those really, at its very basic, they lack housing. So they're either living on the streets, in shelters, either private or public facilities. They could be in transitional or temporary housing, but really at its very basic form, they don't have a stable, permanent place to live. And then in terms of being at risk of homelessness, this category includes those who are living in a doubled up arrangement, their name's not on the lease, They might be living in a condemned building. They might be behind on their rent and utility payments, having an eviction notice and they don't have a place to move, or being in temporary housing, being discharged from a healthcare center like a hospital, or a criminal justice institution and not having a place to live. So these also give some ideas when you're thinking about your outreach efforts, and ways to partner in the community as well. If you're not already partnering with hospitals, criminal justice institutions, letting them know about the PATH program, so that if they do have someone that they're about to discharge and they know that they don't have a stable place to go, and that they feel like they would meet PATH requirements, that they could reach out to the PATH program and you can go meet with that individual to assist with that transition. So often building those partnerships when we're looking at this at-risk community can help us really meet the individuals that are eligible for PATH.
Amy, can I add something to that?
Sure.
Yep. I think it's important that, you know, as you work within the homeless service system, to recognize that the PATH definition of homelessness and the imminent risk of homelessness is different to the HUD and homeless service systems definitions of homelessness and imminent risk. And, you know, most of the time, that's not a problem. You know, if you meet somebody who is living out on the streets or in their car or in a burned out house, it's, you know, that you're going to match that definition of eligibility for emergency shelter, or if you're hoping to get them into a rapid rehousing program, or if you're hoping to get them into permanent supportive housing, you know, that's not going to be a problem. But just occasionally, it's worth remembering that they don't match. And so you may get asked questions. So if you're asked, you know, which one of HUD's 4 definitions of homelessness will your person fall under? It's worth understanding that they are coming from that. And the reason for that's really quite simple. Back when this all started, you know, SAMHSA and HUD weren't necessarily the best at working in a joined up way to understand each other's concepts. So, and then things get put into regulation and law. And then several years ago, HUD made a concerted effort to try to ensure that SAMHSA, Department of Education, Department of Labor, VA, you know, all had access to HUD's housing programs, and so, you know, we're able to access those and use those. But you're going to, you know, if you're working with people who are at imminent risk of homelessness, you're going to have to translate what you're doing into other housing programs, particularly HUD's, and it won't necessarily be seamless. In most cases it will be, but not all. Thanks, Amy.
Yep. Thanks, John, for shedding some light on that collaboration that SAMHSA and HUD are doing as we move towards that more. So when we talk about eligibility for PATH, the next thing we talk about is enrollment. And we'll jump into these terms a little bit more too when it comes to data collection. And that's really where we kind of have these different phases that someone would go through, and that's how we kind of conceptualize the PATH, the essence of the PATH program. So we think in terms of outreach and engagement, and then leading to a point of enrollment. And that's why this really kind of matters. So to be enrolled in the PATH program, really the first step is completing that eligibility screening, determining that they are eligible. So they meet those 2 requirements of experiencing or being at risk of homelessness and having a serious mental illness. That they're interested in receiving PATH services. They understand what the program is and what you can provide in terms of support and services. And then that the PATH record has been started for them, and that's typically in the HMIS system. So by the point of enrollment, if you're determining that you are going to enroll someone in the PATH program, they're going to become a PATH client and be eligible to receive PATH services, these are the conditions that we're looking for at that point. So we have a polling feature here that we're going to use just to create some interactivity here. And we're going to pull up our first poll question and just kind of as a review of what we just talked about. So to be PATH eligible, a person must be experiencing or at risk of homelessness, have a serious mental illness, have a substance use disorder, or is it just A and B, just A and C, or all of the above? And we'll go over those. So we just pulled up our poll. Go ahead and select the answer that you think is best. Responses are anonymous. Feel free to see which way you go. We'll give 1 moment for that. Okay, 2 more seconds. All right, so we have a majority of people participating. So correct response is D, which we have the majority. So be experiencing or at risk of homelessness and have a serious mental illness. And they can have a co-occurring substance use disorder. And you, I'm sure in doing your work, have found that there are a lot of individuals who do have co-occurring mental health and substance use disorders. For PATH, the requirement is just that they have that serious mental illness, regardless of whether that is with or without a substance use disorder. So if you're coming across someone who, yep, sorry.
We can't see the results. You haven't shared them with us yet.
Sorry, can we go ahead and share the results? Maybe if I do, let me see. Oh, there it goes. Yeah, so we have the majority indicating both A and B. So if you're working with someone who, through the assessment, determining that they are experiencing homelessness, but they only have a diagnosable substance use disorder, that's an indication where you'd want to be able to obviously to provide a good referral out to agencies, partners who can provide them the support services that they're looking for. They would not be eligible to receive PATH services if they do not have a serious mental illness. So thanks for doing our poll with us. We can close that out now. And, okay, so now we're going to jump into a broad overview of PATH services and referrals. And so what you'll see here is the menu of services that can be provided through PATH funding. And so either by state or by PATH provider, determinations are made by what should we be using our PATH funding for? What are the needs of our communities? Some providers provide all of these, some of them really focus on just providing one. There are specific definitions for each of these services that are provided in the PATH Annual Report Manual and the HMIS PATH Program Manual. And we can jump into really specific definitions in our PATH data collection webinar. I think we'll have more time there if there are questions about how to distinguish certain services from each other. If we could do real quick though, in the chat box, if you could take a moment to enter which services your PATH agency is currently providing, or just if there's a lot, just 1 or 2 of them that you're focusing on, or that you know that you provide on a day-to-day basis. It'd be really just interesting to know, since PATH programs vary so much across the country. It'd be interesting to know what the focus is at your PATH provider agencies.
So Amy, I just wanted to add to this, all of the PATH programs are within our regional human service centers. So those are community-based mental health centers. So our PATH programs do engagement, they do the screening, they do the outreach, and then those referrals are either internal to the human service center for mental health services or substance use services, or out. And then the general funding, so our federal funding goes to state staff salaries, and the funding that they utilize to assist individuals is state funding. So just some clarification there. And they're all of the same because they're all underneath that umbrella.
Right. Okay. That's really helpful to know. That's great. Okay. If there are any questions at any point about any particular services, feel free to use the chat box. So we'll talk about referrals too. This is again the list of most common referrals that are provided through PATH. Obviously there might be some others that you're providing, but I think these categories typically capture what a typical PATH provider is doing on a day-to-day basis. And Tammy had just mentioned that there are a lot of internal referrals that happen. So when we're thinking about referrals in the context of data collection, and if we're trying to determine, is this a service or is it a referral, the easiest way is to kind of go back and think about the funding stream. So if the staff member providing the service is PATH funded in any way, then that's a PATH service. And if they're not PATH funded, then it's a referral. So even if it's internal within your organization, if you're referring to someone who's not PATH funded staff member, then it would be a referral. And that's what referrals are really capturing, the services that PATH program isn't providing directly themselves. So PATH programs do have limited funding. They don't have the ability to provide everything, not necessarily a one-stop shop. And so it's really important to be connected with other organizations in your community. And PATH providers really are connectors, and they're advocates for people who are experiencing homelessness and mental illness, being able to connect them to the resources that will be most helpful to them in the community. And really the goal is to get people connected to those mainstream resources and to free up your time for doing that outreach and engagement part and getting people connected as much as possible. So we'll do another quick poll question here, just as a review. So providing ongoing rental assistance to an enrolled PATH client is an allowable use of PATH funds. So let's bring up our second poll, and we'll give you just a minute. It's just a quick true or false. A few more responses coming in. Okay, great. Let's go ahead and end our poll and bring up our results. Okay, so we have the majority indicating false, and that is accurate. So when we look at our services slide, there is the ability to provide one-time support for rental assistance or a security deposit, but PATH funds are not intended to be used for ongoing rental assistance, and rather PATH would be connecting someone to housing support program, subsidized housing programs, or finding agencies in the area that can provide support around those applications. PATH funds are intended to be that one-time support. Okay, we can go ahead and close out that poll. Great. All right. Okay, we're just going to do a quick run through of what can be helpful in terms of making successful referrals. Again, because referrals are such a big part of what PATH programs do, it can be helpful to have a framework to think about what can make a referral the most successful. And there's a broad spectrum of what a referral could be. It could be something as simple as handing someone a phone number or an email address and saying, you should call them, they'll help you. All the way through to the other end of walking them through, here's what this organization does. Let's call them together, make an appointment. If you'd like, I can go with you to that appointment and provide support. So thinking about that spectrum, and it really depends on the client, what their needs are, and what they're interested in terms of support. But referral process really would start with an assessment of what the client needs, what their priorities are, how they want to go about addressing those needs, whether they're actually interested in a referral and getting those services, thinking through what the challenges might be. So there might be transportation issues with getting to the appointment, and that would be something that you're able to help with, either with bus pass or actual transportation, or setting up public transportation with them. Or they might have anxiety about seeking out this particular service. It's really helpful when PATH providers can be really familiar with these other organizations in the community, have like a strong sense of what the setup's like, so you can provide those details. If you know someone at that organization specifically that you can work with and have that really strong working relationship with, those often lead to the most successful referrals. And often also just being really confident in knowing that these organizations are knowledgeable about issues related to homelessness, that they're going to support this person and be very respectful to them. That is always a really helpful aspect of the referral process. And then determining whether or not to accompany them. Do they want to be accompanied to the appointment? What is their ability in terms of providing, getting information back and bringing that back to you, ability to tolerate waiting. Sometimes going to social service offices, I know from experience, you can wait a really long time, and it can be really tempting to just give up and say, I can't do this today. And if you have someone there that's willing to just sit and talk, time often passes a lot faster, and you actually get through and make it to the appointment. And that can just be really crucial. And these are the services that are so specific to PATH. Again, this is a service that mainstream services support systems aren't necessarily going to provide the ability to go and wait at an appointment with someone. So it's really, though, feeling out the level of need. Obviously, you can't do that for every client. So which clients are most in need and most want this type of support. And then making a plan to follow up if you aren't going to the appointment with them, following up to see how it went, or making another meeting to identify what the next steps will be. Okay. We'll bring up another poll question to introduce our next section related to the continuum of care. And we're just interested in knowing whether your organization is actively involved in your continuum of care. So we'll bring up our third poll question. Quick yes, no, or you're not sure. This will just be really helpful for us to get a sense of where things are at. And this is kind of alludes back to what John was talking about with the SAMHSA and HUD collaboration. So we're really hoping to see a lot of active involvement. Okay, great. I see Tammy saying that all PATH staff are recommended to be involved in the COC. And it really just makes really good sense, especially when we're talking about referrals. It makes it a lot easier when you're connected with your COC. Okay, we can go ahead and end our poll. We have everyone so far that's responded says yes, so that's wonderful to hear. And I'm going to go ahead and turn over to John to talk about COC involvement.
I'd like to invite everyone to put in the chat box a couple of ways that they're involved in the continuum of care. So go ahead and just stick in a couple of their ways that you actively partner with or work alongside the homeless COC. Okay, so we're starting to get a first few responses. Jerry says we're going to attend state coalition and state CSC meetings, participate in local cares meetings, local outreach meetings, etc. Jasmine adds participation in monthly meetings, attending trainings. And then Tammy writes, attend CSC meetings, attend work groups with CSC staff. North Dakota CSC coordinator is Chanel Willer, who works with the North Dakota Housing Finance Agency. Anyone else? Anyone else doing any active work or partnership work with your local homeless CSC? okay, we have very new staff at this time. Okay, that's fair enough. So if you're not sure, by all means write, I'm not sure, in the chat, or just leave. Okay, so the COC program. Like it or not, we are all involved in the COC program. Our Continuum of Care, and this is a term that means many different things to many different people. To some, it's a fundraising program that provides money for housing, for permanent housing, for transitional housing, for supportive services. To others, it's a group of stakeholders who work together to take responsibility to end homelessness within the region. All of these are true. It's one of those common terms that is just used, or has been historically and traditionally used to insinuate and to capture a number of different meanings. However, about 10 years ago, what was a loose competition for funding and a group of committed stakeholders that came together to write policy and to make recommendations, was transformed by the COC interim rule. That was the first time that regulation was used to build out, what the Continuum of Care was in terms of authority, policy, and best practice. And they went really in three different ways. So, the Continuum of Care has to designate an agency to provide HMIS. Okay, the COC Board of Directors can either designate it, or they can, or give that power to, a sub-recipient, but they are responsible for ensuring HMIS is there. They're also responsible for setting homeless policy, and they are responsible for ending homelessness within their boundaries. And then finally, they're also responsible for building what's called a coordinated entry system. And I'll come on to that in just a moment. But it's designed to build a community-wide commitment to ending homelessness. So the COC should have local service providers. It should have a representative from behavioral health, from education, from the VA, it should be made up of a group of stakeholders within your community. It provides funding. It does that through an annual competition, which in the homeless service system is known as the NOFA. It provides funding to nonprofits, state and local government, and it's primarily focusing on housing, rehousing folks who are experiencing homelessness. It's also responsible for ensuring that it follows many of USICH's policies, particularly around using mainstream programs. And the cooperation between PAD and SAMHSA is a large part of that. And then optimizing self-sufficiency amongst those experiencing homelessness. The COC board is charged with ensuring that there is, folks with lived experience on their board, that they listen, that they take those views into consideration, and that they consult with folks with lived experience throughout their policy making. Can we go to the next slide, please, Amy? Okay. As in, many of you have written that you do the things that we should all as COC members be doing. So participating in COC decisions around, what housing is needed. According to our community, we may need a more permanent supportive housing, or we may need more rapid rehousing. We may need more transitional housing. Ensuring that your board understands from your perspective as a PATH team, what your priorities are in terms of housing is a critical part of being on that COC. You also need to be participating in discussions about the coordinated entry system. HUD and SAMHSA made a deliberate decision about 5 years ago that PATH teams had to be a part of coordinated entry. And they did this because they were primarily concerned that as HUD moved into this coordinated entry system, the folks that were working with people who were living on the streets were in many communities PATH, which was SAMHSA. And so ensuring that all PATH teams collaborate, work with, make referrals to the coordinated entry system meant that the PATH clients should be at the head of the list for referrals and services within coordinated entry. So what is coordinated entry? Coordinated entry is the COC's attempt to make sure that those who need housing are prioritized first. So those who have multiple needs should be at the head of the coordinated entry prioritization list and receive housing in an expedited way. Now, who does that remind you of? That reminds you of PATH clients. And I remember when we were working in Denver, Colorado, one PATH team described coordinated entry as their Christmas day of housing, because it meant that all of a sudden, those folks with the greatest needs, in many cases PATH clients, were getting to the top of the housing waiting list in a far faster way than they had been before they built coordinated entry. If coordinated entry is working in a correct way, it should be working for your PATH clients. And if it's not, that's an ongoing conversation that you need to be having with your COC board of directors. This should be a great advantage for folks. In order to, be a part of that, we have PATH teams have to be a part of the HMIS database system. Most, if not all, coordinated entry systems are run through HMIS in some level of fashion. And so, PATH teams should be providing input around, the usability of HMIS, around how easy and how user-friendly it is, or the lack of therein. And then using the HMIS data. HMIS data has often been accused, or the HMIS database has often been accused of being great to enter data, hard to pull it out. And so you should be working with your COC board of directors or HMIS admin to ensure that you have the data, that data that I talked about at the beginning of this presentation around racial equity, that all the universal data elements and the program data elements, that you get access to that, and you get it in a way that you can use to analyze your work. And Amy in particular, and I spent many years working with SAMHSA and HUD to ensure that the HMIS data elements meant something to PATH teams in particular. So there's a shared taxonomy now that is common between SAMHSA and HUD. Okay, I'm going to pass it back to you, Amy.
Great, thanks, John. All right, you set us up for our PATH data collection discussion, and I think we're going to pull up our last two set of polls. So for both of these, there is no right or wrong answer. We just want to get a sense of how you're feeling about path data, data collection in particular. So let's go ahead and pull up this fourth poll, just indicating this is really like a Likert scale. How much you agree or disagree with this statement: collecting path data is important and can help us improve our program and services. So I know that likely none of you chose your job because you wanted to collect data. Not necessarily the most exciting thing in the world, but just like to get a sense of where people are at with this data collection. And then as much as I love data, I will not be offended by your responses, and they are anonymous as a reminder. So please feel free to be honest. And if you selected the wrong answer, I think you can go back and switch it. We won't hold it against you. You can't switch it? Wow. All right. Zoom really holds you to those initial answers. All right, we won't hold it against you. All right, so we've got majority voting. So let's go ahead and close out. We'll share the poll results. Okay, so a little bit across the board, but we have a little under half saying we strongly agree with this statement, and then kind of spread out from there. So now we just have a sense of where people are at with that. And let's go ahead, I'll pull up our slide for the next one. So I'm confident that I'm collecting and reporting accurate path data, inputting accurate path data, and this would really be on the client level end. So into your local HMIS system, how confident are you that you're doing this accurately? So go ahead and take a minute for that one. Okay, we can go ahead and share the results. Okay, so a little over half indicating yes, you're confident in that, and then a few no. And so we have a webinar dedicated to path data collection coming up next week. So hopefully by the end of that, and after you start implementing what we talk about there, everyone will be saying yes to this. And our goal here today is to just provide a broad introduction to data collection and get you thinking about some things over the next week and a half, so that you can kind of come to that data collection webinar maybe with some questions or some additional information about areas where you're unsure or facing the most challenges. Oftentimes there's a question around the distinction between HMIS and PDX. These are the two main data systems that path providers are asked to interact with, and a lot of times frontline workers are really just using HMIS, and it's really just one person at a path provider agency inputting that provider level data into PDX. But as Jen has talked about, HMIS or Homeless Management Information Systems, these are local systems. They're locally administered. These are the systems that store the client level data. So that's, as you're very familiar with, that's where you're inputting all that client level data, collecting the path data elements in that system. And that's used at the community level. And then the Path Data Exchange is another online data collection tool. This one is hosted by SAMHSA, and it aggregates path provider HMIS data. So data is getting extracted from HMIS at the provider level. So there isn't any client level data that's going to SAMHSA. It's all aggregated at the provider level. These are the number of people we serve. These are the services that we provided to them. These are the characteristics of those people, the demographics. So that's provider and state level data, and SAMHSA then uses that to report on path program outcomes, and there's certain requirements that SAMHSA has to report to Congress each year. So that's just a quick distinction between those two systems. And then this is our path data collection workflow. If you have a chance, enter into the chat box whether you've seen this graphic before or if this is new to you, just a quick yes or no. Just be interested to know how much this is kind of facing frontline path workers. We'll focus a lot on this whole process at the Path Data Collection webinar, but to provide a broad introduction, this really provides a map of a typical Path client encounter and then process. And so we have the point in where, as John noted, SAMHSA then started borrowing or using some of the terms that HUD uses so that there can be a common language. So we have a project entry, this is a common HUD term, and then contacts. So from the very first contact, that's when a potential Path client is considered to be entering the Path project. And each time you interact with a potential Path client, that's considered a contact, and those get recorded in HMIS. And that's really kind of capturing that level of effort, that engagement that's happening throughout this process. So you have that point of project entry, and then from that point forward, you enter into this phase of engagement, and that could really be just as quick as a few hours, or it could stretch over a period of months. As you know, it can take time to build trust when working with the Path population, and you have that time to do that engagement over as many contacts as needed or as the person may be interested in at that time. When you reach the point of engagement, that's defined as when an interactive client relationship results in a deliberate client assessment. So when you've reached the point of engagement, that means that you've had the ability to make a determination as to whether or not that person is eligible for the Path program. And as we talked about earlier, that's, again, determining that they are experiencing homelessness or at risk of homelessness and they have a serious mental illness. And by that point in the HMIS system, the goal is to have collected all of the universal data elements and all of the program-specific data elements. And we'll go through what each of those are on our data collection webinar. But it's throughout that process that you're kind of building out that record and kind of going on a treasure hunt, trying to collect all of the information so that you have a full HMIS record when you're ready to start at the point of enrollment. So you reach the point of enrollment, that's the point at which Path-funded services and referrals are provided. And so up until that point, the main service that's being provided is that outreach and engagement, and that's still like completely okay to do. It's just there's a distinction made that up until the point of enrollment, it's just outreach and engagement that's happening. And then at the point of enrollment, that's when there's the green light to begin providing those more intensive Path-funded services and referrals. And again, this whole process could happen in the matter of a few hours with a person, or it may take months to get through each of these phases. And then as you work with the person, once they're enrolled, you're recording the services and referrals that you're providing to them. And then you get to the point of project exit, and that's when they have stable permanent housing, or you've fully transitioned them to mainstream resources. They no longer need Path services. They've decided to leave the program on their own. They feel like they don't need Path services anymore, or you don't have contact with the client. And for this is determined by the state. For North Dakota, that's 90 days. So if you're trying to find the person or you're reaching out to them by phone, however you contact them, and for 90 days you're not able to get in contact with them, at that point you would exit them from the project. And obviously the ability to start again if you do find them after that 90-day point. Broad overview of what this Path data collection workflow looks like. Over the next week or so, think about, as you're entering your data and interacting with your clients, what that process looks like as it applies to the process outlined here, and areas where you may have questions or where you may be unsure about how that data entry works. And please bring those questions to our webinar next week so that we can address those and really take a deeper dive into data collection. And we'll make a convincing argument for why it's important. Okay, so we're going to hop into our last section. Here we're providing a broad overview of best practices for Path programs. We'll talk a little bit about outreach and then just kind of go through some of the best practices that you'll see in terms of outreach and in terms of just implementing Path programs in general. And each of these best practices will be talked about in detail at the webinar on Wednesday. So a big plug to please come to that webinar on Wednesday. I think that you'll find it very interactive, engaging, and useful. And obviously we don't have the time here to dive into each of these. And so that's why we've separated these out into 3 different webinars. So best practices for PATH programs, the main thing is to prioritize outreach. This is the unique service that PATH provides. Again, PATH providers are specialized in working with individuals who have serious mental illness, are advocates for that population. And so it's really important to go through that process of outreach to seek out those individuals who would not typically seek out services on their own. So here we have the PATH definition of outreach. So identifying and engaging with those who are potentially PATH eligible. Obviously, there's no way to know until you start talking to someone and learning more about their story and being able to do a screening. That's the only way you'll find out whether they're actually eligible for PATH. But it's really about that active outreach. Oftentimes there's a term in-reach that happens, and so we kind of distinguish between these just to make it, if it's helpful to have that that language. But it really, outreach and in-reach are kind of talking about the location of the services and really whether it's active or passive on the PATH provider's part. And what PATH is looking for is for providers to be going out to the locations where they know or think that individuals experiencing homelessness congregate in their community. That will look different in every community. And then actively seek out those people and let them know who you are, what services you provide, how you can support them if and when they're willing, interested in having those services. So oftentimes in-reach would be someone who's set up in a service center, maybe has an office there, available for individuals to walk in, have an appointment, sit down, talk about services. That's certainly useful and helpful to have, but true outreach is going out and seeking those individuals who aren't the ones who are going to come in and say, hi, I need help. How can you support me? It's definitely useful and helpful to help those individuals as well. And you can make that determination if they're PATH eligible. True outreach is that active part and identifying those locations where those individuals may be and actively seeking out ways to support them. This is a broad overview of what the outreach process can and should look like in the PATH program. So locating those who would not otherwise receive services, spending that time to develop a trusting relationship, assessing their health and behavioral health needs, and providing those PATH funded services once they're determined to be eligible, and then referring to those mainstream resources, so setting them up with whatever it is that your community has that they could benefit from, making those connections, exiting them when they have the support they need, and then going on and supporting the others at the start of the process. So here's a broad overview of some specific best practices to incorporate into outreach, and you may be familiar with some of these, some may be new, some you may be interested in learning more about. That's what Wednesday's webinar is for. Trauma-informed care. This is providing services through the lens of trauma. So acknowledging that many people, especially those who are experiencing homelessness, have experienced trauma, some very significant trauma, and understanding the way that that affects their behavior, affects the way that they interact with others. And so starting from that point in that lens, making it a strengths-based approach, ensuring that the client has control, choice. Often an analogy that I would use with clients is that we're in the car, they're in the driver's seat, I'm in the passenger seat. I can help give directions, provide some support and advice, maybe my own turn that way, maybe that way, but ultimately they're the ones driving, they get to decide which direction they go. It's this fundamental shift instead of just approaching and thinking about what's wrong with you, but what happens to you. So really putting that trauma at the forefront and understanding the huge impact that that has. Harm reduction, again, this is talking about recognizing the risky behaviors that clients may have and helping them to reduce those behaviors, providing sets of tools and resources to reduce the risk and not expecting or hoping that they will completely abstain. It's really an evidence-based strategy. It's shown to work. This might look like communities having a safe place for drug use where that's monitored, reducing overdoses, and really just there's a really wide array of tools and resources that communities can provide from a harm reduction standpoint. And there is a lot of movement towards this. I think there was just a headline the other day about the federal government making a push towards more harm reduction programs.
I think you can see in both terms of a set of grounding philosophies and then a set of practical strategies. And we all use harm reduction every day, hundreds of times a day. When we finished here, I'm going to jump into my car and go and pick up my son from camp. I'll start the engine. What's the first thing I'll do? I'll put my seatbelt on. Why? Because it reduces harm. We all use harm reduction in all kinds of ways in our professional and our personal life. And once we start thinking about, we're just managing everyday risks in our lives, it just becomes a much more simple, straightforward thing and takes the kind of value judgment out of what harm reduction truly is. It's a move towards abstinence that incorporates managed use, safer use, abstinence, but really it allows, as Amy said, it allows the person to be in the driver's seat and set the pace and the terms of success. Sorry, Amy, I'll let you go.
No, you're good, John. John, I'll have you walk us through housing first, since that's one of your big areas of expertise.
Sure. Housing first is really just another form of harm reduction. It acknowledges that people are safer in safe, stable housing, and that we should move them there without preconditions as quickly as we can, in allowing them to make as many choices as possible. So, it's a basic human right. We know that people do better in safe, stable housing than they do on the streets, in the homeless service system, or in unsafe, unstable housing. That's not rocket science. So we place them there, and then we provide them with the services that they need and want, and allow them to dictate the pace of those services. And unsurprisingly, it's very successful. It's very successful if people use the model and keep fidelity to the principles. It works extremely well. And I'm talking as an ex-Rapid Rehousing and Housing First provider many years ago in England. I had to be persuaded to move towards this model. I wasn't naturally drawn to it, but I just found that people were succeeding in housing much more than they were in the homeless service system, and that's borne out by research. Sansamberis's kind of 2004 research shows that more than 80% of folks were successfully housed for 2 years. And that was a real wake-up call to many of us who assumed that people had to wait in order to be had to be service ready before they were housing ready. Anyway, back to you, Amy.
Thanks, John. So we'll just walk quickly through some of these other best practices, and I know we're reaching towards the end of our time, so I will encourage you, if you have any questions, please go ahead and enter them into the chat. And we'll be happy to address any of those, or we'll also share our contact information at the end. You can reach out to us afterwards as well. So other best practices to incorporate, if you're not already, motivational interviewing. So that's acknowledging and understanding the stages of change and facilitating those motivational conversations. Motivational interviewing is an evidence-based practice. It's a huge other thing that could be like a week-long training. But just understanding, and maybe this is something that you already have received training in and something that you're implementing. But if you're interested in learning more about it, certainly bring that up to your supervisor, because it is a really wonderful tool for working with clients and setting those conversations in a way that really motivates towards change and understanding where that person is at and starting there. Path programs are culturally responsive and they focus on racial equity. John gave us a great intro to racial equity and why that's so important at the outset. They implement peer support services. I know this is something that North Dakota is getting started with, which is wonderful. And John's also talked about why that is so valuable and can be so helpful for PATH programs in particular, in the homeless service system in particular. And they also prioritize self-care. And this is something that our colleagues Ken and Stephen will talk about at Wednesday's webinar and provide some good tips for self-care. Tammy's mentioning the PATH manual. So we're developing a state-specific PATH program manual for your reference and use. And so it's really intended to be an all-encompassing document that provides a lot of the similar information that we provided here, but just in manual form so that you can have it as an ongoing reference and also can be used to orient new staff that come on board. So it really provides an overview of what the PATH program is, what the data collection requirements are, and then some information about these best practices. So a little bit more detail for these best practices. So we want you to have that as a reference moving forward. So here's the information about our upcoming webinars. So this Wednesday at 3 o'clock Central, talking about effective outreach and going into a lot more detail about the best practices that we provided a quick overview of today. And then next Thursday, July 8th, again, 3 o'clock Central, we'll dive into PATH data collection. Please come to both of these. And I'll say the effective outreach might be a little bit more engaging and interesting, but I'm up to the challenge of making PATH data collection engaging and interesting. And we've done it before. So please come to that one too. But I think you'll really love both, and especially Ken and Stevens on Wednesday. So we are available for questions. If you have any, please feel free to enter them into the chat box or unmute and talk. We'll just give it just a few minutes because I know we scheduled ourselves for to end a few minutes ago and want to keep everyone on schedule with the rest of your day. Please feel free to reach out to us by email if you think of anything afterwards, or if you have anything in particular that you'd like us to address at the upcoming webinars. We'd be happy to incorporate that.
Thank you so much, John and Amy. I've just been so excited for these webinars to come because I just feel like we have to bring that piece to North Dakota where we have the definitions, how to start, because we're just looking at a really new staff. We're just really looking at new supervisors. This program has been implemented within the Human Service Centers for several years, but I think this clarity is going to be really important. So I just saw that Leanne has a question. Leanne, that is a decision of the Human Service Center. I think you and I had talked about that list of diagnoses that the Human Service Centers follow. So that would be the one that would be relevant for PATH as well. But I thank you guys so much. Absolutely.
We're going to be sending out the slides to you. Would you be able to disperse them?
Yes, I will do that.
It might be tomorrow before we get to them. And then we'll send a recording out in the next few days.
Okay, perfect. Thank you guys so much.
Thank you.